I'm Raj Madison. I'm the head of cardiothoracic surgery at UKZN. Cardiothoracic surgery is about mainly lung and heart surgery, but we operate on everything in the chest, including the chest wall. The heart operations that are done are mainly done on the heart-lung machine. They are quite complex procedures where we connect the patient to the heart-lung machine, stop the heart, and undertake surgery. And these can vary in children that are 2 or 3 kilos, or it can be a patient that's 120 kilos that requires, say, a valve replacement or coronary artery bypass graft. But cardiac surgery is complex, delicate surgery. It requires a person to have the technical skill and the technical fine skill. The operations are long in cardiac surgery. A short operation will take about 4 hours, and an average operation is about 6 hours, and they can even take much longer, 12 hours, 14 hours. So it demands that the surgeon must be like a comrades marathon runner. And also one needs to be mentally strong as well, because one deals with operations, and sometimes cardiac surgery has a mortality on the table where about, depending on the operation one is doing, it can go up to 10%. So one must be mentally strong to be able to deal with that. However, our training is rigorous, intense, and I'm proud to say we trained the first Black African female surgeon in the country, and we've trained 4 female surgeons already, and there are more surgeons that are in the pipeline training. The point I'm making is that cardiac surgery used to be male-dominated, but it doesn't have to be that way. As long as you've got the work ethic, the technical skill, it's achievable for everyone. This department is 60 years old, was 60 years old on Saturday. And we're proud to say we've got a good name both locally and internationally. And a lot of our surgeons are also working internationally. We do about 400, 500 cardiac operations a year, about 250, 300 thoracic operations, mainly lung resections a year. And we have extremely good results. Our patient population is mainly rural, so in Nkosi Albert Luthuli Hospital is the only public sector hospital doing cardiac surgery and thoracic surgery. So KwaZulu-Natal has a population of about 11, 12 million. We also serve half of the Eastern Cape. And our population is mainly rural. The types of diseases that we see is rheumatic heart disease. So we do undertake a lot of operations for replacement of heart valves, closure of defects in the heart, holes in the heart, and coronary artery surgery, which is a disease more of affluence. With the result, we've got a good balance of training in both and service delivery in the complex congenital heart surgery, adult heart surgery, as well as thoracic surgery, which is mainly lung resection.
Hi, so my name is Dr. Nandi Pandevi. So I'm the cardiac surgeon. I'll be doing this operation. My assistant is Dr. Hibish. That's Munir Hibish. He's also a consultant cardiac surgeon. This is our senior registrar, Desigan Pile. And this is our scrub nurse, Sister Mata. So everybody knows their roles, which makes the operation move a bit smoother. I don't have to communicate much with the sister because she knows the steps of the operation. She knows exactly what I'm trying to accomplish every time I lift my hand. So right now we are harvesting the right internal mammary artery. We're also going to turn around and do the left internal mammary artery. We're going to use these conduits for the bypass operation. That's what we're doing here today. They are harvesting the saphenous vein from the right leg. We're going to use that as one of our conduits for the bypass operation. I'm one of 2 female cardiothoracic surgeons in the unit. This field is male dominated. So I would encourage our young colleagues to take up the speciality. Women can do it, and their unit has the tools to produce world-class cardiac surgeons.
My name is Dr. Yakin Harila. I'm the head of cardiovascular perfusion. We're part of the highly skilled cardiac team that's responsible for cardiopulmonary bypass during cardiac surgery. We use very specialized equipment, including this machine that you see here, which is the heart-lung machine. It's responsible for taking over the function of the heart and the lungs during bypass. And we are responsible for maintaining physiological function of the patient during the operation. I have a master's and a PhD in cardiovascular perfusion, and I am a trained specialist in cardiovascular perfusion, together with a host of other team members that also perform practice here at Albert Lutuli. We've done a lot of research within the department, together with some of the professors from UCT. One of them is Professor Bruce Picard. And as you can see, we've published in peer-reviewed international journals. This is some of my publications. We've done research on neurological outcomes for cardiac patients within this unit in order for us to ensure that we have better practice, not only within the unit, but also used as a guide for international practice as well.
My name is Suren Maraj. I'm a scrub sister here in cardiac theatre for cardiac surgery, and also we call cardiothoracics as well. And anyway, my role as a registered nurse is scrub for cases, all cardiac cases that go on bypass surgery. That's including adults and pediatric surgery. So my role is to scrub for a coronary artery bypass, which is person that has blockage in the coronary arteries, and then we get them to surgery after all the workup is done by the doctors and the registrars in the wards, and they come up for surgery. Then we prep them, and all this important, as a scrub sister, we have to set up the instruments. That's our first part that we need to do, and we liaise with the surgeons with everything else that goes on. We have to be prepared in advance, so we have to support the surgeon while in surgery. Sometimes we assist them, and we have to know this, basically what they go through, we go through, because the length of these surgeries are long, sometimes 8 to 10 hours, sometimes longer, and we have to be all the time on the ball. It's very highly stressful, fast-paced, and sometimes what the surgeons go through during the surgery, we feel with them, we go to the same emotions.
Anyone that is thinking of a career in medicine, I would highly recommend think about cardiothoracic surgery. It's a discipline that's very rewarding, very fulfilling. It requires a lot of hard work. There'll be lots of birthday parties and weddings missed because you'll be in theatre or your patient will be unwell, but at the end of the day, one is here to help humanity. And if you've got that special skill of being a cardiac and thoracic surgeon, I think it's important to lend that skill to help anyone that requires your help.
I'm Dr. Sanveer Maraj. I'm one of the senior cardiothoracic registrars in the Department of Cardiothoracic Surgery in Albert Lutuli. So part of the requirements for joining the Department of Cardiothoracic Surgery in Durban is that as a prerequisite, students are required or need to complete their community service. They need to spend at least a year of training in a general surgical discipline. They need to have their primaries in general surgery undertaken, as well as at least 3 to 6 months of ICU training or rotation in ICU to help assist them in bettering their chances to get into the program. It is also recommended that they complete their intermediate examinations, and that'll obviously increase their chances of getting into the program. But those are the basic requirements before getting into the cardiothoracic surgical training program. The one thing that's always fascinated me about cardiothoracic surgery is the intricacy and speciality regarding especially interventions with heart pathology and lung pathology, but more specifically with the heart pathology. I've always been fascinated with all conditions to do with the heart from the time I was a student. It's a very demanding specialty, very, very intricate. It is one of the super specialties in medicine. Very demanding in terms of time, very demanding in terms of academia, but I feel that the rewards, it's very rewarding in the sense that once you see patients, when they come to you and they're quite sick, you do the surgery and the intervention for them, and then once they're done and they recover from their process, when you see them in the clinic afterwards, after they recovered, there's such a significant improvement in their overall clinical condition. It makes being a cardiothoracic surgeon or in the department very rewarding and very special.